If you survived a stroke, do you know the one step that can sharply raise your chance of emotional recovery if you take it within 6 months?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, joined by Alara Skye, and today we're focusing on mental recovery after stroke.
Post-stroke challenges go far beyond movement or speech. Depression affects roughly 1 in 3 survivors, and anxiety affects about 1 in 4. These symptoms are common, real, and often missed. When they're ignored, your recovery slows and the risk of long-term decline rises. Early attention changes the trajectory.
New data from England's National Health Service helps clarify what effective support can look like. Researchers reviewed records from 7,597 adults who had experienced a stroke and later entered the NHS Talking Therapies program for depression and anxiety. The goal was to see how well this commonly used talking therapy serves stroke survivors dealing with emotional fallout.
Everyone in that data set had a documented stroke, plus clinically significant depression, anxiety, or both. Average age was nearly 58. Participants with stroke tended to be male and to carry additional health conditions compared to matched controls. Therapy benefited both mood and anxiety, though improvements were more pronounced in anxiety.
Outcomes were encouraging. About 71% of stroke survivors showed a reliable improvement in symptoms during treatment. Roughly 49% reached a point considered full recovery, no longer meeting criteria for depression or anxiety. A smaller group, about 7.3%, experienced reliable deterioration, reminding us results are strong overall but not universal.
Symptom scores underscore the change. Average anxiety ratings dropped from 13.4 to 7.9. Depression scores declined from 15.8 to 9.3. People also reported moderate gains in daily functioning, your ability to work, socialize, and engage in life. These shifts matter because emotional stability supports the practical steps of rehabilitation.
Timing stood out. Starting therapy within 6 months of a stroke markedly improved the odds of recovery. Those who delayed a year or more had about 20% lower odds of full recovery and were more likely to worsen. Early engagement reduces risk and positions you for better mood, thinking, and participation in rehab.
Another finding helps you interpret your own outlook. Underlying physical illness, conditions like diabetes, heart disease, or other neurological damage was a stronger driver of poorer outcomes than the stroke event itself.
While the study wasn't designed to map brain pathways, the pattern suggests how talking therapy may assist you. Structured conversations help interrupt negative thought loops, organize recovery goals, and guide emotional adaptation to a major life change. When mood lifts, you're more consistent with exercises, appointments, and lifestyle adjustments that reinforce progress.
Let's move into practical steps you can use or share with someone recovering. Recovery does not end at hospital discharge. Your mood, motivation, memory, and capacity to relearn skills all interact. Addressing emotional symptoms early can unlock better results across the board.
First, act fast if neurological symptoms return. Sudden dizziness, confusion, blurred vision, facial drooping, or slurred speech, even if they fade, require emergency evaluation. Clot-busting drugs work only within the first 3 hours. Fast treatment preserves more brain tissue and improves the odds that you'll walk, speak, and think clearly.
Second, keep melatonin and methylene blue in your emergency kit. Stroke and heart attack damage tissue by cutting off oxygen and then unleashing free radicals when blood flow returns. Melatonin is a strong antioxidant that helps neutralize oxidative stress during that window.
Methylene blue supports cellular energy. It helps your cells keep producing ATP, the energy currency your body depends on, even when oxygen is limited. Using melatonin and methylene blue together targets both oxidative stress and energy failure, giving vulnerable brain and heart cells more protection during an event.
Third, schedule talking therapy within 6 months after a stroke. The NHS data showed that early therapy dramatically raises your chance of improvement and lowers the risk of getting worse. If you've been waiting for mood swings or fear to resolve on their own, consider this your prompt to book the first session.
Even a short course of structured sessions can help restore mood, memory, and motivation, so you stay engaged with rehab and daily life. When anxiety eases, sleep may improve. When depression lifts, you're more willing to practice speech drills, mobility work, or cognitive exercises that drive recovery.
Fourth, add Gingko early to support brain repair and clearer thinking. In a 2023 study involving 3,163 ischemic stroke survivors, participants who received daily ginkgo-diterpene lactone meglumine injections within 48 hours of the event showed significantly better cognitive scores after 90 days compared to those who did not receive ginkgo.
Researchers suggest ginkgo's benefits may relate to improved blood flow, reduced inflammation, and cellular protection. Providing that support early appears to give your brain a stronger platform to regain function and reduce longer-term decline.
Fifth, move your body and retrain your brain with intention. Your nervous system adapts when you give it repeated practice. Start with gentle, safe movement and build as you can. Combine physical activity with targeted cognitive work to promote new connections that bypass damaged areas.
Practical ideas include crosswords, memory games, or simple balancing exercises performed regularly at home. Don't reserve the work for scheduled rehab visits. The frequency and consistency of your own effort shape how well alternate pathways develop.
Let's integrate these points into quick takeaways. An important step after surviving a stroke is to start psychological therapy as soon as you can, ideally within that first 6-month window, because it significantly raises your chances of improving depression and anxiety that commonly follow.
Talking therapy helps by reducing those symptoms, improving mood, and restoring a sense that you can direct your recovery. It supports social re-engagement and cognitive function, both of which make your physical rehabilitation more effective and sustainable.
Regarding melatonin and methylene blue, remember their complementary roles. Melatonin limits oxidative stress. Methylene blue helps sustain energy production when oxygen drops. Together, they offer strategic protection during and immediately after a stroke or heart event.
For Gingko, the evidence shows better short-term cognition when given early after ischemic stroke. That advantage is linked to circulation support, inflammation control, and cell protection. Early intervention is the theme that keeps showing up.
Physical and mental activity matter because repeated challenge drives adaptation. When you move, think, solve, and balance, you encourage new pathways that help you recover abilities affected by stroke. The more consistently you engage, the stronger the gains.
Here's your challenge. Over the next week, identify where you are in your recovery timeline. If you're within 6 months of a stroke and not yet in therapy, schedule it. Assemble an emergency kit with melatonin and methylene blue. Consider early Gingko support. Build daily movement and mental trainings into your routine, and track your mood.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.